7 causes of foot pain you can't walk off. Your feet take a beating every day, but we sometimes neglect how much stress we put on them or wear the proper footwear for the right situation. However, having sore feet can slow you down or worse, make it almost impossible to walk. There are many foot and lower leg conditions that can be assessed by a podiatrist or a doctor to help put a spring back in your step. Whether you need orthotic shoes or have another underlying health condition, here are 7 possible reasons your feet are tender. One. Metatarsalgia. The Mayo Clinic explains this is a condition that affects the ball of your foot, near the front of your foot before the toes, causing inflammation and pain. Although generally not serious, metatarsalgia can sideline you, notes the source. Those who participate in running and jumping sports are more likely to develop this condition, it adds. There are DIY treatments such as ice and rest, and you should also consider footwear with insoles that better absorbs shocks, according to the clinic. Two. Neuroma. The American Podiatric Medical Association explains this is a painful condition resulting from a non-cancerous growth of nerve tissue between your 3rd and 4th toes. It can also cause a burning sensation, tingling or numbness, it adds. The association explains this condition can make walking difficult, literally causing patients to stop in their tracks thinking there is a rock or another object in their shoe. An improper shoe that causes the toes to be squeezed together is one possible explanation for the problem, it explains. Three. Plantar fasciitis. WebMD calls this the most common reason for heel pain, affecting the plantar fascia, which is the ligament that connects the heel bone to your toes and supports the arch, it explains. If you strain your plantar fascia, it gets weak, swollen, and irritated, says WebMD. This can lead to pain when you're walking or even standing. While it commonly affects those in middle age, it can also affect younger people that are on their feet often, it adds. Being overweight is another risk factor. 4. Athlete's foot. As the name suggests, this foot skin condition often affects athletes, but can strike anyone. It's also called tinea pedis and is a contagious foot fungus that can spread to the toenails and even the hands, according to Healthline.com. It carries symptoms such as itching, burning, blistering, and even toenails that separate from the nail bed. Being barefoot in locker rooms or having a minor skin or toenail injury are risk factors, it notes. While the condition isn't considered too serious on its own, you should consult a medical professional if you have diabetes or a weakened immune system, it adds. 5. Achilles tendonitis. The American Academy of Orthopedic Surgeons says this causes, sometimes severe, pain along the back of the leg, near the heel. The Achilles tendon is actually the largest tendon in the body, and connects the calf muscles and the heel bone, adds the source. Although the tendon is considered quite resilient, the tendon can be strained from playing running and jumping sports, it adds. There are 2 types of Achilles tendonitis. Non-insertional means fibers in the middle of the tendon have begun to break down and swell. This commonly affects younger people, and insertional, which involves the lower portion of the heel where the tendon attaches to, explains the Academy. Six. Bunions. These are characterized by a bony bump at the base of the big toe, the Mayo Clinic explains. It forms when your big toe pushes against your next toe, forcing the joint of your big toe to get bigger and stick out, it notes. Causes for bunion formation are wearing shoes that are too narrow, but can also be the result of an inherited structural defect or excess stress on the foot, adds the clinic. The skin over the bunion can become red and sore. 7. Corns calluses. These are hardened layers of skin on the feet that are caused by pressure or friction, explains WebMD. While both can make walking painful, corns generally occur on the top and sides of the toes, while calluses, plantar callus, are generally found on the bottom of the foot, it adds. Again, improperly fitting footwear is the main culprit of these foot problems. However, high heels are a particularly bad offender, according to the source. If you don't walk a lot or are confused about the root cause, you should have it inspected by a doctor, as it could be a wart or a splinter under the skin, it adds.